All right. I am Lygeia Ricciardi, and I'm from the Office of the National Coordinator for Health IT. And I want to start off by giving a shout out to my co-authors on this paper, which include the head of our office, Farzad Mostashari, Judy Murphy, Jody Daniel, and Erin Petter Seminario, who is here in the room with us in red. Give a wave, Erin. Don't be shy. Excellent. So there we go. So our topic is a national action plan to support consumer engagement via eHealth. The really big picture takeaway that I want you all to have here is that eHealth is an enabler. It's an enabler of patient engagement in all of the ways that we've been discussing it today at this conference, whether it's shared decision-making, research, patient-centered medical homes. eHealth is a set of tools which can be used well or used poorly. But what we believe is that there's an incredible opportunity to jump onto the fact or to take advantage of the fact that the healthcare system is in the midst of going digital in order to push forward patient engagement, to take advantage of these tools that are changing the system and changing so many parts of our society and use them for this goal. So first of all, what is eHealth anyway? Well, we define it as a set of electronic tools and services that are primarily consumer-oriented, but there's some overlap with the term health IT or health information technology, which I think of as more conventionally used for providers, like electronic health records, health information exchange. Some examples of eHealth, to give you the sense that it's a pretty broad bucket of tools. Internet portals, personal health records, something as simple as secure email, personal monitoring devices, mobile apps, online education or peer support communities. So there's a whole lot in this intersection of technology and health, again, with a really primary patient and consumer focus. So what can you do with it? What's so great about it? Why are we so excited about this? Well, there are a few big buckets of kind of value from eHealth. One is that it can help consumers to communicate and coordinate better with providers. It helps people, and this is all, the research backing this up is in our paper. It helps individuals to prepare better for clinical encounters and to ask better questions when they are in the midst of an encounter or afterward, for that matter. It enables them to coordinate care among various providers and among non-traditional providers too, such as family caregivers or others. It also helps a great deal with self-management of health. And here I'm really thinking about health more than health care per se. So when we think about the impact on traditional health care, studies such as the one put out by Open Notes reported that more than half of participants in their study, through which patients had online access to their own health information, including doctors' notes, more than half of those participants increased their rates of medication adherence, which is pretty impressive. But also outside of that, people are just using a whole variety of tools to better manage their chronic conditions. We're seeing a drop in blood pressure associated with personal health record use, for example. And a good 59% of participants in a study by Patients Like Me, which is an online condition-focused community study, found that participation in the site was really helpful for them in managing their symptoms. And sometimes the value of peer-to-peer support goes beyond and is helpful in ways that information directly from providers isn't. For example, a peer can tell you how to navigate a supermarket using a cane. Your provider probably wouldn't help explain that to you. Part of what's exciting about eHealth, too, is that it seems to have at least potential. We often hear when we start talking about technology, people go, oh, what about the digital divide? Are we going to leave some people behind? Potentially. Again, health information technology or eHealth, it's a set of tools. We can use it well or we can use it poorly. I think there's incredible evidence that if we use it well, it can actually help to empower and engage members of underserved populations. So, for example, one thing people often say is, the elderly, they're not going to use these tools. Well, in fact, 17% of seniors use personal health records, which is actually the highest proportion of any age group. There's also a California Healthcare Foundation study that showed that low-income, chronically ill people who use personal health records experience more positive behavior changes and they ask more questions than members of other groups. So there is some really potential strong value, again, if we use the tools intelligently. Why is it critical that we pay attention to this right now? I'm guessing you can't read that slide, and that's okay. My first point here is that, again, the healthcare system is in the midst of going digital. And what that graph shows, this is from ONC, and it's really about adoption of electronic health records and similar services by the healthcare system. Basically, as of now, 72% of providers are using an electronic health record. And this shows that a few years ago, only half that number were doing so. So this is a really huge jump in a very short period. And this graph just breaks down some of the specifics of, e-prescribing and different kinds of uses of health information technology. So part of this is due to the Meaningful Use Incentive Program that is put out by our office and by CMS. But the point is that we've been talking about health information technology for many years, and finally it's becoming a reality. Beyond that, though, there's a broader technological revolution. Computing power is doubling every 18 months, and I'm talking much broader than healthcare. I'm talking about our society, our worlds, the fact that most of us have at least one electronic device, the fact that this conference is trending on Twitter. So, and as computing power grows, the ability to do cool things with it really expands. Back in the 70s, people were starting to experiment with email. By the 90s, you had a browser on the web. The 2000s, early 2000s, you had YouTube. And now, granted, this may be, not widespread, but computers enable quadriplegics to control artificial limbs with their thoughts. Okay, not mainstream yet, but the point is you can do much more powerful things as the power of computing expands. Also, financial responsibility for healthcare is growing as a result of health reform. And lastly, in terms of the why now, people actually really want this. A lot of times people will say, are consumers interested in being engaged in their care? Do they want electronic access to their health information? Yes. 80% of internet users are already online searching for health information. 65% consider it, they consider online access to their health information important. And a similar number would actually consider switching providers to get online information to their health information. So, takeaway is it's a perfect storm of opportunity to make this the moment to really support and enhance and leverage consumer e-health. So we at ONC view ourselves as catalysts for change. We are players in this field, but it is a much broader world of players that will make real change come about. Our approach is grounded in the 3 A's, as we call them. The first A is about access, that you have to enable people to access their health information digitally. The second A is about enabling action. And this is really about the fact that you don't just want a data dump as a consumer of your health records, whether it's from your doctor or from your devices. You want to be able to do something useful with it. So we try to encourage the development of an ecosystem of tools that are truly actionable and useful for consumers. And the third piece is about shifting attitudes. There's been a lot today about the fact that we need cultural shifts to really feel comfortable with patients engaging in their care, and that's not unique to eHealth. So what are we doing in these areas? Well, on the access piece, we're doing a great deal. Again, through the Meaningful Use Incentive Program, we are that's pushing all this adoption of electronic health records up. We are pushing patient engagement through it by requiring, through stage 2 of meaningful use, that every patient who is served by a doctor who receives these incentives must have the ability to view and download and transmit their health information. This is a big deal because it goes beyond just looking at your information on a portal. It means you can pull it down and either share it with somebody else if you want to email it by secure email, or you can plug it into an app or tool and do something cool with it. Another term for all this is blue button. Who's familiar with the term blue button? All right, good, excellent. So you may have heard of it originally in connection with the VA, where it was used initially as just a simple ASCII text download file for veterans. But Blue Button is really expanding in a couple of ways. One is the meaning. It's now a broader sense of access to information digitally for consumers and the ability to download it. But it's also really growing exponentially in its use. The Department of Defense, Aetna, United, many provider and payer organizations are adopting it, particularly through something called the Blue Button Pledge Program. So I would say we have more than 450 organizations participating, and we estimate that among data holders, these people and their customers reach about a third of the country. So this is some impact, particularly as meaningful use requirements ripen and take effect at the end of this year and early 2014. In the action piece, we're supporting information technology developers and building new tools. Yesterday, we released an implementation guide to something called Blue Button Plus, which is basically a blueprint, a predictable structure for developers that gives them, and for data holders, that gives developers the ability to get structured data from Blue Button and to automate its use. And we think that's really going to turbocharge the growth of new tools and apps. We also have amazing challenges to spur the industry on. On the attitudes piece, we have a lot of materials on our website, healthit.gov. We have stories of and by patients, videos that many of them have created. We have an animation about eHealth and its value. And we rely also on members of our pledge community to help get the word out to their particular constituents. So again, in summary, eHealth is a tool. Let's leverage it and leverage it together to meet these goals of patient engagement. Thanks.